Hello, everyone. Welcome to the GSA webinar, Making Our Research, Practice, and Academic Knowledge Relevant in the Policy-Making Arena. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. A question and answer session will follow the live presentations. Throughout the program, we will be accepting questions through the questions feature accessible on the GoToWebinar panel. Without further delay, I'll hand the microphone to Linda Herudian, Chair of GSA's Public Policy Advisory Panel.
Good afternoon. On behalf of the Public Policy Advisory Panel, I want to welcome you to our webinar today. The panel has had as a priority educating GSA members about the importance of linking science and knowledge to policy decision making. We have certainly seen the importance of this link during the COVID crisis. This session will provide an opportunity to better understand the role that GSA and its members play in public policy, and an opportunity to discuss the value of making it a part of your work. We are pleased to have three excellent panelists today who represent a range of disciplinary perspectives. Our panelists include Dr. Stephen Ostad, Distinguished Professor and Chair of the Department of Biology at the University of Alabama at Birmingham. He studies virtually every aspect of aging, from demography to molecular processes to the societal impact of an aging society. Dr. Martha Crowther is a tenured professor at the University of Alabama College of Community Health Sciences in the Department of Community Medicine and Population Health. She is a trained psychologist with extensive clinical and research experience in interdisciplinary healthcare, health disparities, mental health and aging, and caregiving. Dr. Darina Petrovsky is a postdoctoral fellow at the University of Pennsylvania School of Nursing. Her unusual background that combines music training and nursing science has led her to pursue research with the goal of improving the lives of older adults living with cognitive impairment using non-pharmacological approaches. Brian Lindberg, GSA's policy consultant, will begin our webinar with an overview on using knowledge to educate and influence aging and healthcare policymakers at both the federal and state levels. Brian brings a wealth of expertise in policy. He is the executive director of the Consumer Coalition for Quality Healthcare and worked for Congress for 10 years on both the House and Senate sides. He and I also developed and conducted a policy institute that we ran for nearly 20 years for the Faculty Scholars in Geriatric Social Work program. Brian, I'll hand it over to you.
Thank you, Linda. So there I am. Frankly, I haven't had a suit or a jacket and tie on since March 14th, but back in the day before the pandemic, if I was heading up to the Hill, I might actually look something like that. Let's go to the next slide, please. So it is a beautiful city. You're going to get my view of it today. It's a beautiful city, and actually it is a fabulous fall day here, just about as beautiful a day as you'll get all year long. And I'm very pleased to be a part of this webinar today, and special thanks to Linda and Trish for their great work in public policy. My job is to get us started by sharing a bit of my perspective on GSA's Washington, DC based public policy advisor, and at times lobbyist. Let's go to the next slide, please. So let me begin with a quick mention of GSA's role in public policy, which I hope you hear about it sometimes, but let me say a bit more. As we look forward to the 117th Congress, which starts in January, the legislative process will begin anew with introductions of bills, hearings, committee markups, floor debates, and votes, and much more. And we'll have a lot of new members of Congress and new staff. We'll have new opportunities to testify, provide data and research, and share program and policy innovations with all of which will be intent on improving the quality of life for older adults and their caregivers. All this got me thinking about what we do at GSA in support of public policy and GSA member involvement in public policy. Many of you may know Patricia, we say Trish, D'Antonio, who is GSA's Vice President for Professional Affairs and leads public policy efforts, in part by representing GSA at numerous professional organizational meetings, in coalitions, committees, work groups in the field of aging and health. Excuse me. These include Friends of NIA, the Leadership Council of Aging Organizations, work with the National Alliance for Caregiving, the Coalition for Clinical Trials, and many more. GSA has also established itself as a convener of multi-stakeholder collaborations in the field of health and aging. For example, the Elder Care Workforce Alliance and the National Adult Vaccine Program. And of course, we're involved in public policy through Linda's work and GSA's Public Policy Advisory Panel, and all it does, including today's webinar. My job is to support all those efforts by providing some strategic direction, knowledge of the legislative and regulatory process, and I monitor the Hill and assist with advocacy. We also call that lobbying sometimes in Washington. And now and again, we actually develop legislative language and try and influence Congress to pass it. Let's go to the next slide, please. So you can tell from what I've said, there's a lot going on here in DC, but it's primarily GSA members who make the biggest difference. GSA undoubtedly is home of the world's leading researchers in aging and its scientific publications, and the annual meeting, which of course you'll be attending in a week or so, set the standard in the field. In my view, this should be translated into GSA being the primary point of contact about aging research for policymakers, members of Congress, members of the press, the general public, and folks in the executive branch. If you have ever read my newsletter column, you know that I'm frequently bragging about the amazing work that GSA members play in the legislative and regulatory process through testimony primarily, and sharing knowledge with key stakeholders and policymakers. Now more than ever, we realize how essential it is to have policy tied to facts and science. So with the beginning of this new Congress, the 117th Congress, there's an opportunity to engage members of Congress and their new staff in GSA advocacy and educational efforts. This past year, you've probably read about it, but I'll just mention it again. You're probably aware that we were quite involved in legislation related to NIA, the Older Americans Act, the GWEP and GACA reauthorization, the pandemic, vaccines, and much more. And hopefully you'll keep looking at my column in the newsletter, and Trish has a part of that column as well, where she gives up-to-date things letters we've signed on, other advocacy we've done. A few years back, Trish asked me to draft a survey and speak with a dozen or so staff on key congressional committees and in key personal offices about their knowledge of GSA, their use of our publications, and the value we bring to informing staff and members and what we could do to be more helpful. We learned a number of ways to refine, improve our contributions to policymakers and improve our outreach and value as resources to policymakers, including preferences of staff for executive summaries, to accompany things like the public policy and aging reports and articles in our journals, and more. We also heard about ways they like to receive information and connect with members. They told us about the value of fact sheets, talking points, op-eds, the use of infographics that they like to see associated with pieces from GSA members, and how we could use tweets and other tools to help share our information. The bottom line is that they want to hear about your work, and they appreciate summaries and other, shall we say, abbreviated versions of our great work to help them determine whether they, first of all, need to read the whole lengthy articles and papers, and how their members and the committees can use that information effectively. So to the extent we're able, the policy team will work with you to secure opportunities, to be supportive when you do have an opportunity to share your work and share it in an effective format for the Hill. So let's go to my last slide, please. So thank you for hearing my Inside the Beltway perspective. The real stars of the webinar are the three well-respected GSA members who are going to provide their perspectives and experiences in making our work relevant to policymakers at both the federal and state levels of government. You heard a bit about them at the beginning from Linda, so let me hand the webinar over to Steve, then Marcia, then Darina. Thank you.
Thanks, Brian. Welcome, everybody. It's very nice to be here. The panelists have been asked to address 4 general questions, and so I'm going to go through those 4 one by one. The first question is, how does your work help improve the lives of people as they age? Now, to tell you the truth, what I spend most of my time doing is using animals to try to understand basic biological processes of aging. So on the face of it, you might think that I would be pretty much the last person in the world to talk about how my work improves the lives of people. But I think I can make a pretty strong case that it does. So the goal of my research and others in the field is to find ways to treat the underlying processes of aging as if they were a disease. And by doing so, what we hope to accomplish is to delay and ameliorate all of the diseases, most or all of the diseases and debilities of aging at the same time. In other words, our goal is to extend the healthy years of life. And what I would like to point out is that I think that what we do already is provide hope to people, hope that they may not age the same way that they have seen their parents or their grandparents age. One of the things that I would like to point out is that one of the newest discoveries in the field is really that it's never too late. Using animal research, we know that even at relatively advanced age, some of the methods that we've discovered to slow the aging process seem to work quite nicely. Now, I'd also like to emphasize that we're making incredible progress. My job using animal models is to basically make discoveries to get them to the point where they're ready for human clinical trials. And to give you some idea about how much progress we're making, I'd like to point out that there are more than 20 clinical trials now ongoing of drugs to ameliorate the processes of aging. You don't necessarily hear about this because we've had to disguise some of these clinical trials as treatments for diseases. That's not because that's what we're really about. What that is, it's an artifact of the approval process. There is no approval process for drugs to ameliorate aging, but there is for drugs to ameliorate diseases. And I would like to point out that there is a GSA symposium that I'd like to bring to your attention that I organized called Biology of Aging for Non-Biologists. And here we have a series of panelists who discuss in lay terms exactly what these exciting results that I'm talking about, where they stand right now. So I think I'd rephrase that initial question of how does your work help improve the lives of people as they age as to how will your work help improve the lives of people as they age, because we're really very, very close to making some breakthroughs. And if we in fact find ways to delay or eliminate many or all of the diseases and debilitations of aging as a group, I can't imagine anything that will improve the lives of people as they age to the same extent. The second question, how can the knowledge from your work influence public policy? Well, even though we don't have anything that I can claim for certain right now affects human aging, I do think the knowledge that treatments for aging are going to be emerging in the not too distant future should start us thinking now about the public policies relevant to the existence of not just more and more older people in need of medical care, but of more and more older, healthy people in need of ways to continue to feel that their lives are worthwhile and that they're contributing something to society. I think the time to start thinking about that is now, before we're actually facing this surge of healthy older people, in addition to the surge that we're more concerned about, more immediately concerned about, the surge of older unhealthy people. What we're really talking about here is the possibility of changing the trajectory of human life. If we could anticipate another 5 to 20 years of healthy lives, that might completely allow us to reimagine the way we lead our lives. We might think of serial careers. We might think of going back to schools late in life. It basically will change everything. The third question, and the one that I think is most relevant for our talk today, is what areas of policy do you think your research touches upon? And what I have to say to that is, what areas of policy will having more and more healthy older people not touch? Some things spring immediately to mind. Retirement policy, for instance. I think it's relevant that when Social Security came into being in 1935, a life expectancy at 65, the retirement age at that point, is exactly the same as it is today at age 75. So even though life expectancy has made these dramatic advances, retirement policy has not really kept up. Now, I'm not claiming that we should immediately change the retirement age to 75, but I am saying that I think an important policy consideration is exactly what we should be doing with retirement policy. I've written a number of op-eds on this, and every time that I do, I get a barrage of emails of people that really reveal to me exactly how complicated retirement policy is, particularly in the case where we have some people that are healthy at 90 and some that are unhealthy at 60. So science policy, I think, is a clear thing. Where do we put our scientific budget? The National Institute on Aging budget is now over 8% of the total NIH budget. That's a brand new development, mainly because of concern about Alzheimer's disease. Education policy, environmental policy. One of the things we know is whether we make dramatic breakthroughs in the biology of aging or not, the 21st century will see the biggest increase in the global older population of any century before. And that's going to affect the global population, and that's going to affect the environment. And as we all know, it's already affecting our climate, and we need to address that as well. And I'll finish up here with the fourth question. The fourth question is, what experience have you had in policy? And I will have to say that I think I've had relatively little. I have written a number of op-eds. I had an op-ed come out in Next Avenue earlier this week on what to expect for older people from a COVID vaccine. And that's really, I think, where I've had the biggest impact, which is not to say that I have had an impact. I have visited the FDA to try to convince them to reevaluate how they approve drugs that are really seeking to address aging. I have done a little bit of pounding on doors of representatives in Washington, D.C. to advocate for specific research projects. And I currently serve on the policy group of a local effort to improve the health of Alabamians. And what I've discovered from being on that policy group is that sometimes it's not the policy itself that needs addressing. What really needs addressing is the implementation of that policy. So those are the 4 questions and the way that I would answer them, and I look forward to hearing from the other speakers. Back to you, Brian.
Thank you. Let's go ahead and Martha, please let us know what you're thinking about those questions.
Absolutely. Good afternoon, everyone. Again, my name is Martha Crother. Let's see, I will follow Steve and read the question and then answer. How does your work improve the lives of people as they age? I will start by saying my research and clinical work really, they go hand in hand, and I do a lot of integrated care. I see patients in psychiatry, behavioral health, but I also see them in family medicine. And that has really helped me understand the relationship between my clinical work, my research, what I teach. It all works together. And I also, excuse me, do a lot of work with underserved populations, in particular rural populations and minority populations. And I do a lot of work with caregiving. Although different than how we typically think about it, I've done traditional caregiving where someone is taking care of an older adult, but I also do a lot of work with the older adult as the caregiver. So older adults taking care of their children taking care of their grandchildren primarily because their children are unable to provide the care. I think all those facets of my research and clinical work absolutely improve the people's lives as they age. I feel like it helps people think about stressors related to aging. It helps them think about family issues that may be arising, such as caregiving as they age. It helps them think about their health as they age. And I really see that when I'm in family medicine. People are there, and if they're having difficulty with physical health related issues, often that may lead to anxiety or depression, and kind of being able to help them cope with their mental health issues, but also kind of thinking through and helping them and their physicians develop strategies to deal with their physical health issues as well. How can the knowledge from my work influence public policy? I think the knowledge from my work can influence state and federal policies related to caregiving, as well as mental health and aging topics. Caregiving is not a new topic, it's been around for a while. However, we aren't really moving the needle very far. We're moving it, but maybe not as far as I would like in terms of how we think about the older adult as the caregiver, not just the care recipient. And ways we as a country, ways our federal policies can change to make it easier for someone to provide care for their loved one. What areas of policy do you think your research touches upon? I think my research touches upon several areas of policy, including healthcare policies, prevention and treatment of persons with mental disorders, training of behavioral health providers, and broadly speaking, just more training of health education policies related to training. I think that's a really big deal. So in terms of healthcare policies, I think most of those policies have just focused on physical health, and typically with younger populations. But we really need to push the envelope there. As Steve mentioned, people are having more healthy years as they age. And what does that look like? How do we keep those people being healthy? How do we talk to populations about health? But there's we've all talked about health disparities. There are a lot of older adults who are aging who really don't understand how their behaviors are impacting their health and well-being. So you have older adults who are not eating very healthy diets. You have older adults who are not engaging in other healthy practices, and that impacts their physical health, it impacts their emotional health, and they just don't know that. I was talking yesterday to a physician, and he was saying he is a nephrologist, and that he has so many patients who end up on dialysis but don't really understand how they got there, and they don't even understand dialysis, so it's really hard to talk to them about treatment when they don't understand the cause. So we can do a lot in terms of influencing health policies, how we think about policy, how we provide funding for prevention, not just the cure. So we could do better with our health education policies. That would help a lot. We could all use the money in training and providing more prevention strategies, mental health prevention strategies, as well as physical health prevention strategies, and training a cadre of healthcare providers who are really prepared to provide healthcare for an older population. I am pleased to say I was one of the founders of our geriatrics clinic at my, where I provide clinical services. And it's really nice. We have an integrated geriatrics clinic. And it's nice that someone can walk in there and they can get all of it. They can see pharmacy, they see the physician, they can see social work, they can see a psychologist. That means we can do really good assessments, mental health assessments, physical health assessments, make sure their medications are working. So all of that's really important, and that's how we need to think about healthcare policy from the integrated care perspective, providing what we need, or what older adults need. And the question number 3, what areas of policy do you think your research touches upon? I feel like I've answered that. And question number 4, what experience have you had in policy? I'm a clinical psychologist by training, and I have done the American Psychological Association has asked me to do Capitol Hill visits. So I've met with Congress people and senators related to funding more psychologists for training, in particular to train in integrated care settings. I've also done congressional briefings requested by the American Psychological Association. We've done those, I've done those with others to talk about successful aging, to help Congress people understand what aging is, how to think about aging successfully, how they can think about that as they consider caregiving policies, as they think about healthcare. And I've also currently, I'm on a federal committee, which I'm incredibly excited about, the federal committee was organized by the Administration for Community Living, and the purpose of the committee is to address a federal approach to grandparents raising their grandchildren. There's an increase in our country of grandparents raising grandchildren and being able to, we don't have a federal policy to help those caregivers. So I'm really excited to be on there. It is cross-disciplinary. So I really love playing with and talking to other disciplines, particularly as we reach toward a shared goal. So that's very exciting. And I'm also part of a state committee addressing suicide prevention in the state of Alabama. I'm proud to say we hosted the first suicide prevention conference in Alabama last January. And it was really exciting to see people come together and talk about how can we do a better job at just thinking about mental health prevention practices so that we don't have someone who is contemplating suicide. And if someone is contemplating suicide, how can we do a better job at providing services for them and making sure healthcare providers, teachers, school counselors are just better informed. People who work in VAs, just all these kind of points of entry for people, that those providers are better informed of how to address behavioral health issues and how to address suicide prevention. So I feel like my work is broad, but what's core is the need for us to work across disciplines, pulling together to think about how do we provide the best physical and mental health care for an aging society. I'm really excited about what I do, and I hope my overview, I hope that came across in my overview.
Well, thank you so much, Martha. And that leads us to you, Darina. Take it away. Thank you.
Sure. Hi, everybody. So I'm quite early in my career as compared to my colleagues on this webinar, and I have just begun to think about how my work hopefully will influence policy related to older adults. My research interests, as you can see on this slide, are related to music-based interventions for older adults who live with dementia. My clinical background has been in long-term care with older adults. And then when I decided to continue my studies by getting my PhD, I focused more on older adults who live in the community. As some of you may know, the majority of older adults who have a diagnosis of dementia or have cognitive impairment, they reside in their community, in their homes. And so I built my intervention work around this population, which I think sometimes it gets ignored from policies surrounding the care of older adults. And so in terms of my own work, how does my work help improve the lives of older adults? I think it does so in several ways. Right now I'm working, just finished a clinical trial of a music-based intervention for older adults focused on sleep. So my goal is to provide and build the evidence for non-pharmacological interventions such as music to help those living at home with a diagnosis of dementia. And I've just conducted my first study in this area, and I'm trying to think with the implementation goal in mind. I think as Steve alluded to, the implementation being sometimes one of the biggest barriers in getting our interventions out or our work out, as well as the implementation of policies. So I'm trying to develop my next study with the end goal in mind in terms of how would this work be implemented in the real world, and how can I design my studies now that they are implemented in the best way possible. And so the question is, how does the knowledge from my work influence public policy? I hope that it will influence the policy in a way that older adults who have dementia and who are living at home have access to these non-pharmacological interventions. The question about what areas of policy do you think your research touches upon? I think one of the areas that really is sort of the most obvious one is, of course, related to reimbursement practices for non-pharmacological interventions, since oftentimes these interventions are considered not evidence-based or not having enough evidence behind it to be reimbursed. So I think that's one of the areas that I plan to look at and plan to examine. Another area that I've recently gotten involved has to do with the whole idea of the term dementia. So I'm just started serving on a working group as part of the Advisory Council on Alzheimer's Research, Care, and Services. And the purpose of this work group is to gather feedback from clinicians on the term dementia and whether that term specifically is best understood by lay people as well as the research. That's my new area that I just started in, and I'm really excited to see where our work takes us. Some of the other, similar to the other speaker, my interest also lies at the intersection of caregiving in older adults, and specifically in terms of how can we equip caregivers who take the most brunt when working with older adults with dementia in a home setting. So even though I originally started my work focusing specifically on older adults with dementia, I soon realized that it's not just them that I need to focus on, but it's the dyad of older adults with dementia as well as their caregivers. So my work has thus expanded to include the caregivers in my research. And so, and my last experience that I hope will be helpful for me is recently, last year, I was selected as a Jonas Policy Scholar with the American Academy of Nursing. And this work is not related specifically to aging, which I sort of undertook. I knew that going into the policy fellowship, but I sort of saw that as a challenge because I wanted to see what are some of the areas that the Academy of Nursing is looking at in terms of policy, outside of aging. So it's definitely been a great learning experience so far. I'm in my second year of the policy fellowship, and I've been learning a lot about different areas that the Academy is focused on in terms of policy. So I think hopefully I've answered all the questions. Thank you.
Thank you so much. Well, very different presentations, all very interesting from different perspectives, and you covered a range of aging issues as well, which is one of the challenges I think GSA has. Is we could be advocating and educating around aging issues every day of the week up on the Hill, because we cover such a range of important issues in this space. We can't do that obviously because of resources, but that's where you all come in terms of your own education and advocacy. Linda, I know you're going to be involved in our Q&A, but why don't I start us off with a question that I have been thinking about, and that is, timing is pretty critical in policymaking. You could spend 10 years on a study, and if you don't have your data, your innovations, your ideas ready when Congress is ready to address it, which isn't always perfect. Sometimes it's just because of politics or the way the process is moving that year. So timing is important. So I'm wondering how the three of you, and I guess we just start with Steve, if you wouldn't mind, how you keep up with what's going on at the federal and state level with the issues that you care most about, so that to some extent you can try to get your research to the right people at the right time. And even if you're not done with something, share what you do know, because they may move forward with the process without you.
Yeah, that's an interesting question. I think a surprisingly effective way to stay up on things for all the bad press it gets is social media. I think if you're discriminating about who you follow on social media, you could actually learn a lot about timing. One of the things that's happened in the basic science field recently is that a lot of research is now published before it goes into the peer-reviewed press in these pre-reviewed journals, and that comes out and that lets you know what's going to appear in the coming months and perhaps years. And that's been particularly important in this COVID times, when information about COVID and aging and how, let's say, vaccines and other treatments are going to affect it. That stuff is coming out so fast and of such varying quality because of the speed that has come out, that actually having a community of scientists that can discuss this and also can know when to move things ahead and try to get them to the attention of your local medical authorities. That's been a route of information that I never would have guessed how useful it is.
Thank you. Martha, did you have a comment?
Yes. Let's see. In addition to social media, which I think Steve is right, it's a great way to keep up with what's going on. I get, let's see, I get a monthly listserv update regarding to like federal grants or state related grants in my area. And that's been really helpful to see what's going on. But it also, that tells me, sometimes I click on those and you can almost track them to what's happening in Congress. Like, are they thinking about different things and what topics are coming up? And I have done a much better job in the last maybe 2 years of really staying in touch with like our State Department of Mental Health and our State Department of Public Health, and talking to a few people there to see, you know, what they're thinking, how things are changing, because they have a really different view than I do sitting in one place in Alabama. They're looking at what's happening across the state, and then they talk to people in their area in other states. So it's a really nice way for me to kind of, in addition to the other ways I've mentioned, just kind of touching base with people who, that's their job, is to pay attention to what's going on, paying attention to the policies. Policy needs to be changed, and also, are there trends related to the aging and the topics that are of interest to me that I need to be mindful of.
Martha, how did you connect with those people at the state level?
Oh, that's a great question. 2 ways. One, there was someone on my campus who was a senior, I want to say a senior statesman, but a professor who was almost about to retire, who had done a really nice job networking. And then I asked him to introduce me some of the people in public health. And he did that, and that's been really helpful for me. And then that person actually introduced me to the person in mental health, and I kind of partnered with her a lot. She's the one who now helped me with the suicide conference and figuring out who else we needed to partner with. So that partnership ended up being the state, one of the local foundations, and then the university kind of helped me with my portion of that. So that's just kind of, I guess, networking, which I'm not good at in general, but I am good about talking to people who share similar interests. So.
Great.
Can I just add a question to Steve on related to that? You talked about having, I think you testified before the FDA, or were at least involved with a meeting. How again, in terms of relationships, which I think and networking are very, very important, how did that come about in terms of doing that?
Our meeting with the FDA, which was outstanding, was actually facilitated by several groups. One of the groups was the American Federation for Aging Research, but also there was a film company that was getting ready to do a video on breakthroughs in aging. And the director of that was Ron Howard. And I think Ron Howard had a considerable amount of leverage, as you might say, to get us that meeting. And it was incredibly educational for me, and I hope it was educational for the members of the FDA as well, because within minutes of going in there and explaining about the biology of aging and what we hope to do, and how a single treatment could potentially ameliorate cancer, dementia, heart disease, muscle, vision, hearing loss, all of those things. The people in the FDA sat up and took notice right away. And so I think networking is really part of this. And I'm not a particularly outgoing person, but by belonging to organizations like GSA and going to the meetings and serving on committees, you find yourself connected in ways that turn out to be beneficial in avenues that you would have never suspected. And I should have mentioned before that one of the ways I do like to keep up as well is I think the GSA newsletter is absolutely outstanding, and I'm hoping that all of the people in the GSA read it religiously when it comes out.
Nice point. It is excellent. I think I just want to emphasize what both of you have just said in terms of developing relationships, whether they be with organizations. I know, Martha, you mentioned APA, GSA, a lot of these, not just national organizations, but then there are more local kinds of connections as well, of people who are interested in your issue. And, Darina mentioned this task force that she's now going to be involved with to help define, dementia and what does it mean. these are important opportunities that you've created, whether you're not, you know, an outgoing person or not, that really make a difference. Martha, I wanted to ask you, you have had some experience on briefings, the Hill briefings, and visiting members of Congress. I wonder, you know, I think for a lot of people it's very intimidating. And I wonder if you could talk about a little bit about how you felt going in and maybe some lessons maybe you learned about those interactions.
Absolutely. It was one of the best things I did as a mid-career person. APA did a really nice job. Diane Elmore, I think she's still with APA. There were 4 of us who were panelists when we did the congressional briefing. But she was also the person who helped with the Hill visit. So I did those on my own, but she helped prep me for them. And that made, to me, all the difference in the world. So she just kind of, the night before I was supposed to go, they already arranged my calendar for me, who I would meet with. She explained to me why I was meeting with particular representatives from the state of Alabama, why they were important. Does that mean, like, she helped orient me to who I was meeting, why they were important, and how they could then help. She also prepared me for, which I hadn't thought about, is how young their congressional aides would be. So I just expected everyone to be more senior, I guess. But they have these really sharp young lawyers, were a lot of them. And it was great talking to them, and when I did the Hill visits and getting to know them. So I think for me, it was a little intimidating, but understanding why I was there and who I was meeting with and their role in the state. So my first one was just with only because who knew Alabama has some pretty powerful people positioned in places like on the Appropriations Committee, chairing the Appropriations Committee, in fact, or I don't know if that's still the case, but anyway, it really helped me to understand all of those dynamics. And I know this will sound silly, but I don't know if you all remember Schoolhouse Rock. There was this song called I'm Just a Bill and I'm Only a Bill. And I remember that as a kid. And I would, Diane and I would sing that song, and she used that song to walk me through the process. And it was incredibly helpful. So to me, it was like really fun and interesting in all these ways to think about how policy was relevant to what I did, because I hadn't really honestly thought about the relevance between my work as an academic or a clinician and how that could be impactful at a policy level. But since then, I've been kind of hooked and wanting to do more and figuring out, you know, how to make sure my work is relevant. That doesn't sound right, but from topic areas that I'm passionate about, how to proceed with them. But I think Diane was my introduction, but understanding the process, how a bill becomes a law, and then it's a law, where does that go until it's appropriated? I mean, it was really, she did a great job educating me about while I was there. And I actually, now that when I teach courses, I make sure all of my students understand the role of policy in our work and how to think through that process. And I feel like we could do a better job making sure as researchers, we explain that to those coming behind us.
That's great. And I wonder if Trish and Brian might want to just comment briefly on GSA's ability to help GSA members with that same kind of process in terms of meetings on the Hill, or just, you know, resources for those, setting up those kinds of meetings and whatnot.
Trish, do you want to start? Well, I'll go ahead and start, and then if she's available to jump in after. Well, you know, we've done everything from, you know, setting up meetings to training people around how the Hill works and how to testify, to drafting testimony, to just editing testimony. We're pretty much available for a range of support. Our members are so well respected. Many times they know before we know that they're gonna have a chance to testify. There are occasions where I'm up on the Hill and I'm saying, oh, I think you should talk to so-and-so, and they end up having a chance to testify, or come in and talk to the staff or the member, but often our members are found before I even know that a committee is looking. So we'll do anything. As I said, we've helped edit testimony. We've set up meetings. If you're coming to DC, and of course this is a little different now during the pandemic, but if you're coming to DC or if you're planning on a meeting or an opportunity to testify, just touch base with one of us, and we will we'll either provide guidance or we'll just watch and be so pleased that you're here in DC or wherever you're doing it remotely, educating, really influencing the policy process. I do want to just make sure that, I don't know, Doreen, if you had anything to add to the any of the conversation we've had so far, basically, because I'm always curious about how people keep tabs on things, but also anything you'd want to just jump in and add from what we've said so far. And then Trish, I don't know if you're able to comment on Linda's question or not.
Sure, this is Drina. I think in terms of how I stay in touch, I don't think I have anything specifically to add, I think, to what has already been said. I have been following more of the work of my colleagues who either are going through or have gone through the Health and Aging Policy Fellowship or the Robert Wood Johnson Health Policy Fellowship, just because they're my colleagues and I see them, see their posts on social media and we talk on the phone. And so I really, I find that, I think, the most convenient way for me to stay on top of things that are going on. And one of my friends just started a podcast. So I really love listening to podcasts, and some of them do a better job with the updates than others. But I found that's a really great way for me to, stay on topic and to make sure I know what's going on, in addition to like getting in newsletters and stuff like that.
Yeah, what a wonderful group of folks end up in those health and aging policy fellow positions every year. We've worked really closely with them. Many of them are GSA members to begin with, but it's a great group, and they have that the luxury, if you will, of being able to spend more time learning about the process and how to influence policy than most of us do, because it becomes a part of their work, obviously, that year that they're a fellow. So anyway, anyone who's listening in here today, take a look at that program and see if it's something that might work for you if you love policy. Linda, did you have some other things to say or want to jump in?
I just want to add to the Health and Aging Policy Fellows. It's a program that I was quite involved with, but I also like to emphasize that they really include fellows at all different levels of career. So we've had some very, very senior people who decided, I haven't had time for this, and now I want to do it, and others who are younger that have decided early on and actually have ended up changing their career trajectory. So it's a great program. I can't, any other questions that you had?
Oh, go ahead.
Hey, Linda, this is Trish. I had a comment, if it's okay. Sorry, I couldn't get off mute for some reason, but so to add, this is Trish D'Antonio, Vice President of Professional Affairs with GSA, and to add to some of what Brian was speaking about, we certainly, as if you are in Washington, we're certainly happy and available to support you when you want to go up on the Hill, or if there are maybe some agencies where you're visiting, we'd be happy to help if you're thinking about you want to get your project in front of somebody. The other thing I think that's important is, as you visit locally in offices, if you hear from staff members G, I'd really like to keep up to date on this. And if you can keep us in the loop, we can visit in the congressional office in Washington at the same time and make sure that that information is funneling through both the staff in DC and the staff in the home offices. I think that's really important when members of Congress hear that consistent message. The other place where I think there's opportunity for GSA to impact policy is when there are applications available to serve on federal committees or state and local committees. If you know you're going to apply for a federal committee position, make us aware of that, because there might be some things that we have learned through the application process that we can help support you in that application process. And then the last place is when there are requests for comment, requests for information, requests for resources. When we post those messages on GSA Connect or through our social media or through our newsletters, when we if you have something that's important for us to include in our comments to that whichever entity is asking for that, please send us something. I can't tell you how many times where somebody says to me, oh, I was going to send something, but I didn't think my information was that important. It really is that important, trust me. So we want to be able to translate research into policy and practice. So this is how it happens. So just think about that as you're conducting your research, because it really can make a difference.
I had a quick comment, and it could be a question as well, Linda, and that is, we found over the years that various institutions, often universities, have different policies. So one of the things we always suggest to folks is if they're reaching out, if they're going to testify, if they're doing certain activities, that they figure out how they need to coordinate with their department or the university's communications team or lobbying team. Does anyone on the panel have any experience with that they'd like to share?
This is Steve. Yeah, I do actually. When I was going around to congressional offices advocating for a specific research project for funding, one of the things that I made it a point to do was to avoid talking to any of the Alabama senators or representatives. And that's simply because I wasn't sure how what I was advocating fit with university plans. And when I got back to the university and I talked to university leadership about what I've been doing, I was very glad that I had not talked to any of our Alabama senators or representatives, because it would have been to a certain extent at cross purposes. So I think it's always a good idea to check with your own lobbyists or the people that can put you in touch with the lobbyists to make sure that you're not doing anything that is working against what your institution is trying to do.
Other comments?
And since we're getting close to the end, any last comments from any of our panelists before we end?
This is Dorina. No, I think I just wanted to comment to say how much I do want to echo whoever said that. I think Steve said that about the newsletter that the GSA has, and I think I'm realizing now more so how my work should influence policy, and I think it has been very helpful to see concrete examples of ways to get involved. And even, Trish just talked about ways to provide comments, and I have done that last year. And I think before that experience, I really didn't see how I could do that. But after having done that, I felt empowered, and I felt like I had something to contribute, and I felt like, all my skills and knowledge that I learned in all my years of education have, prepared me to add to a body of literature. And it might not have been a body of literature that I'm, studying in my research, but I should be aware of sort of what's going on in that area because it is tangential or related to my own work. So I really felt like that was a really great way for me to be involved and feel like I have contributed, especially when I saw the final sort of draft, the final submission, and I saw that my comments were included, and I felt like I contributed in some way. So that was a really great experience, and I hope to have even more of those experiences moving forward.
That's a great example. I did notice that there is one last question. I know we're supposed to end, but the last question up on the board is, well, there are actually two, but I guess if we don't get to them, we will through GSA Connect. But one of them was, how do consumers fit into the picture here? And that's open to any of the panelists.
Well, you know, from the biology perspective, from the perspective of ways to treat aging, one of the things that is true is that there is more bogus or unproven information about this on the internet, on television, and on a variety of media that I would really recommend before people try any self-experimentation. They try to validate things through the scientific contacts with the GSA or other aging organizations, because there's a lot of crazy stuff out there, and people want to believe things that aren't necessarily true. And this is something that those of us in biology worry about, is people hurting themselves trying to do something to improve their health.
Anyone else?
This is Brian. Let me just real quickly say, Linda, that one of the great things about many of the studies and the information that GSA members share with the Hill and other policymakers is that it either includes real people or it really reflects consumers, patients, older adults experiencing various challenges. So in that sense, the Hill, of course, loves to hear stories, real life stories, and our members have been pretty good about incorporating real situations into their academic work and research they share.
Thank you. So this ends our time for questions and answers. I want to thank you all for joining us today, and a big thanks to our panelists, Drs. Ostad, Crowther, and Petrovsky, our moderator and discussant, Brian, and GSA staff members, Trish D'Antonio and Judy Liu. I'm now going to turn it over to Judy Liu, who has some additional information. Thank you.
Thank you so much. I'm so sorry that we've run out of time. A big thank you to our panel and our participants. If you want to continue the conversation, please consider joining us on November 4 to 7 at the Gerontological Society of America's Reimagined 2020 Annual Scientific Meeting online. The meeting will be hosted on a state-of-the-art platform that will offer an immersive experience, allowing you to focus on essential research and networking. So until next time, thank you again, and this is the end of the program.